Hey, not to get too personal, but if you live with somebody who snores or has constant nasal congestion, you could wear earplugs, make them wear one of those, strips on their nose, 24/7. And there's always, I guess you could go with divorce.
That escalated a little quickly
maybe.
there, Terry. Tony Vanetti is checking out a fourth option, and he's also going to tell you how you could get it for free.
With his numbing agents.
His numbing agents.
We're at Advanced ENT and Allergy. It's in southern Indiana in New Albany. I have some numbing agents up in my nose right now. What I'm going to have done is a procedure that will help me breathe easier at night or when I'm exercising. I know a ton of people that are watching this right now have the same thing. Look, we live in the Ohio Valley. It's a problem. Dr. Kakarlapudi is with me. How are you, doctor?
How are you, Tony?
All right, doctor, tell me the procedure and what I'm doing today.
So the procedure that we're doing today is called the VivAer procedure, and it's an in-office procedure done under local anesthesia, like you're having right now, that helps remodel your airway to allow you to be able to get more airflow during the day, and especially at night, and like you mentioned, during exercise.
We talk about how important it is to be able to breathe at night when you're sleeping. We all have this problem. People try to fix it with Afrin, or they use like a breathe right. Those are some of the things that people use before they come to see you.
Absolutely, and those are some medical things that can be done, and for those patients who are not having good success with those or want a more permanent, long-lasting solution, this might be an option for them.
Okay, when we come back at the bottom of the hour, what is going to happen? What are they going to see, and what are you going to do to me?
So we're going to take you over to our procedure room. We've got the numbing stuff, numbing cotton pieces that you have in your nose right now. We're going to put a little bit more numbing stuff inside of your nose, and then we're going to start the procedure to remodel the opening of your nose to allow you to be able to breathe better through your nose.
One of the things that kind of brought me to this also was the easy recovery from this also.
Absolutely. You should be able to resume regular activities as soon as you leave our office.
I love it. That's what we have in mind here. So when you come back, we're going to do the procedure live on the air. It takes about 3 or 4 minutes. Both nostrils or one at a time?
One at a time.
Okay.
We'll do both, Tony.
All right, Dr. K, as they call him, is the preeminent doctor for this one. So if you have problems, not everybody is eligible for this. We'll see what's going on. But you can win this procedure later in the show. So we'll be back.
Great Day Live on WHAS 11 is sponsored by Advanced ENT and Allergy.
Okay, Tony, you can talk. So we are in the midst of our VivAer procedure with Tony Vanetti. We have done the first of 3 segments on the left side of the nose. Tony, you want to...
Easy peasy. Advanced ENT and Allergy is where I'm at. We are clearing my nose and pushing the tissue back. Is that correct to say, Dr.
Correct,
K?
exactly. We're remodeling the inside of your nose in the area called the nasal valve, which is basically like the front door of your nose,
right,
to allow you to be able to breathe better. So we're started. We are about 1/3 of the way done on the left side.
And this is very easy procedure. We're talking just a couple of minutes and we're done here. We're going to talk more about it. How do you win this procedure? We'll find out more. He's going to explain a little bit more about what he's doing right now.
Okay, so we're going to get started on the second aspect, up high in the nose. We're going to apply some pressure, and Tony's not going to be able to talk. And he may feel a little bit of pressure as I'm tugging at his nose and a little bit of warmth. We are not at burning temperatures. We're at 60 degrees Celsius, so below the boiling temperature, but enough heat that he might experience a little bit of warmth.
You're at 12 seconds.
And this is the cool down period. And I'll let Tony talk here in about 5 seconds, and he can share with you what he's feeling.
I feel absolutely nothing. It's actually just a little pressure, and that is it. And that's what I was really hoping I was counting on. So that's 2 of just 3 of those pressures that you're going to do in this nostril, and then that nostril will be done. So I feel really nothing. It's been a pleasant experience so far. Thank you for that. I was hoping. Everybody's nervous before they have some sort of procedure done.
You're a phenomenal patient, Tony.
Oh, thank you so much.
Phenomenal patient.
Advanced ENT and Allergy is where we are today, so we'll give you more information on how you can win this, if you qualify, if this is something you want to do. Back with more of my nose. All right, the procedure's been done. I feel fantastic. I was hoping that's the way it was going to go. I'm breathing a lot more than I was just a couple of minutes ago. Dr. Kakarlapudi is with me now, Dr. K as they call him. He does this procedure all the time. And was I a good patient? Did I come through?
You were an excellent patient, Tony. Excellent patient.
Again, real quick, just explain to everybody what you did to me just a couple of minutes ago.
So what we did, the first thing is we numbed you up with some cotton pieces inside of your nose, and then we injected a small amount of Novocaine-like substance.
Yeah, it was just like going to the dentist and you feel them right before they pull a tooth or work on a tooth.
Absolutely. And then once we had you good and numb, we used our radiofrequency probe, the device, the VivAer device, to basically apply some pressure to remodel the inside of your nose to allow more room for airflow.
And everybody, if you watched that that portion when we did at the bottom of the hour, that was basically it. That was almost the entire procedure. He did a little bit more right after that, but that was it. It's easy peasy.
Absolutely, and you should get back to regular activities. There's no restrictions today, Tony. You can hit the gym and work on your biceps. Go right ahead.
I like Dr. K. He's my man. All right, now here's the deal. He went into another room right after he was finished with me and just did another one, and that person now is breathing better than they did before. So if you have breathing problems, if at night you're having a little tough problem, or if you're at workouts and you're just not getting enough air, this could be something for you. If you qualify, come on in, get an exam, and then have the procedure done. It's really, again, as simple as what you saw. Again, if we didn't stretch it out to do the hour-long show, I would have been out of here a couple of minutes ago. Now, we're going to give you an opportunity to win it. You got to go to WHS11.com/contests and win this procedure that I had done. Again, you're open. Tell us the hours of Advanced ENT and Allergy.
Typically 8 to 5, Monday through Friday.
Okay. And Dr. K is going to do the procedure for you, right?
Absolutely.
I want to say hi to my nurses over there, too. Point them at the nurses. Thank you so much for taking care of me today. I'm usually a big baby, but they described the procedure to me, and it was exactly the way they did. So Advanced ENT and Allergy is located in New Albany. Go to WHS11.com/contest to get in on the freebie, okay? Breathing better.